Police Scotland understand the importance of interdisciplinary working, ever more so at the intersect of policing and health. The complexity of the issues we face now heighten the need for us to take an evidence-informed approach. Developing strong relationships with academia who can provide academic integrity to decision-making and strategy and implementation of practice is critical.
Hi, I'm Inga Haven. I'm an Associate Professor at Edinburgh Napier University. I co-direct the Scottish Centre for Policing and Public Health with my colleague who's here, Nadine Dougal. So Edinburgh Napier University's collaborations with the public sector, third sector, citizens, international partners brings unique opportunities for knowledge development and exchange at the intersect of police and public health programmes.
Thanks, Inga. And I'm Nadine Dougal. I'm Professor of Mental Health and Data Science and co-direct the Scottish Centre for Policing and Public Health, as Inga mentioned. And our partnerships seek to improve, strengthen and sustain practice to address complex societal issues in Scotland, things like drugs-related deaths and mental health distress. And our overriding aim with all of our work is to improve the lives of people in our communities.
The COVID-19 movement restrictions put a sudden stop to the ways we rely on to know how children are doing. We needed new ways to swiftly capture what was happening to support children. So 17 international partners joined forces with Inspiring Children's Futures at the University of Strathclyde in 2020 to create the COVID 4P Log, a human rights-led multinational smartphone app based on the 4P model for children's well-being. Bold and innovative, the app gathered more than 3,300 daily insights from adults working with and for children in 22 countries on 5 continents. In partnership with children, like the COVID Under 19 group led by the international NGO Terre des Hommes, and experts like Child Rights Coalition Asia, we discovered what people were seeing on the ground in real time, and we strengthened our partnerships along the way. Together, we generated and shared useful resources, podcasts, infographics, videos, learning series, offering insights, solutions, and innovations for policies and practices. These aided global and local advocacy efforts to best support children during emergencies, and they help us prepare to respond in the future, to fulfill our vision that children and young people reach their full potential, especially those facing adversity.
The African, Caribbean and Black communities have been identified as having very low COVID-19 vaccine uptake according to Public Health Scotland data. In the first quarter of 2022, the COVID vaccine uptake was lowest in the African group at 41.7%. This compares to 75.4% in the white ethnic group. One of the strategic objectives of the Scottish Government and Public Health Scotland is to generate community-level insight and data to improve health inequalities through partnering with the University of Glasgow. This project led to the production of Scotland African Voices film. The partnership between the University of Glasgow research team, Public Health Scotland, and the Scottish Government has enabled us to continue to work with communities with trusted voices, to understand issues and deliver relevant messages